Welcome to the Political Bridge, where we connect different viewpoints on the issues shaping our world. I'm Ada, your host. Today we're diving into a topic that still sparks strong feelings: Dr. Anthony Fauci's influence and public statements on COVID-19 lockdowns. During the pandemic, Dr. Fauci was a key voice in the federal response. His recommendations for public health measures, including lockdowns, had a huge impact on daily life for millions of Americans. We'll explore the arguments around his advice, its effects, and the ongoing debate about its wisdom. We'll look at the science, the economic costs, and the social changes that followed. Nico, Jordan, thank you for being here to discuss this complex issue. Let's start with your opening thoughts on Dr. Fauci's role.
Ada, it's clear that Dr. Fauci's influence on COVID-19 lockdowns was immense and frankly damaging. He became the face of policies that caused widespread economic and social harm. We saw businesses close, jobs lost, and children kept out of school. The estimated economic toll of the pandemic in the U.S. was $14 trillion by late 2023, with many small businesses closing permanently.
Nico, I understand the concerns about the impact of lockdowns, but we must remember the context. In early 2020, we faced a novel virus with unknown dangers, killing thousands daily. Dr. Fauci, as the nation's top infectious disease expert, provided guidance based on the best available science at the time. His statements aimed to protect public health and prevent our healthcare system from being overwhelmed. Organizations like the AACI strongly supported his recommendations. Many studies show that lockdowns and stay-at-home orders were effective in controlling the spread of COVID-19. They reduced infections, which ultimately saved lives. The goal was to reduce transmission and keep people safe. This was a global crisis, and leaders worldwide made similar difficult decisions.
Both of you highlight the immense stakes involved. Nico, you point to the economic and social costs, while Jordan, you emphasize the public health imperative. My first follow-up question for both of you is this: how do you reconcile the evolving nature of scientific understanding during a pandemic with the need for clear, consistent public guidance? It seemed like the advice changed often. How should public figures handle that?
Ada, the problem wasn't just evolving science. It was Dr. Fauci's certainty and his dismissal of dissenting views. He shut down scientific debate. He conveyed a certainty in public that, according to his own diaries, he didn't even feel in private. For example, he recommended closing schools early on, despite evidence suggesting otherwise. We now know the 6-foot social distancing rule, a cornerstone of lockdowns, was arbitrary and not based on science. This lack of transparency and the changing guidance eroded public trust. When public health officials aren't upfront about what they know and what they don't, it creates confusion and distrust. This is why Dr. Fauci's public statements on COVID-19 lockdowns became so controversial. People felt misled, and that's a huge issue for public confidence.
Nico, the idea that Dr. Fauci was not transparent is unfair. He consistently emphasized the importance of following data and facts as they emerged. Science is not static. It evolves as new information becomes available. What we knew in January 2020 was different from what we learned in July. Dr. Fauci had to adapt his recommendations based on this new understanding. For instance, he initially advised against masks, then later supported them as more was learned about airborne transmission. This isn't a contradiction, it's how science works. Critics often forget that he was leading the charge against a rapidly changing virus. His role was to give the best possible public health advice, even when it was an inconvenient truth. His public statements on COVID-19 lockdowns were aimed at protecting the public, not misleading them.
This brings us to our stress test. Nico, you argue that Dr. Fauci's influence was damaging due to economic costs and a perceived lack of scientific basis for some measures. However, you haven't fully addressed the immediate public health crisis that prompted these actions. Millions were dying. How do you weigh those lives against the economic impact in the early days? Jordan, you emphasize the evolving science and public health necessity, but you haven't fully acknowledged the long-term negative consequences of those policies, like learning loss in children or mental health impacts, which some studies link to lockdowns. How do you account for those significant harms?
Ada, it's not about ignoring lives lost. It's about questioning whether the chosen path was truly the best way to save them, given the known harms. Lockdowns caused millions of people to lose their livelihoods. The economic disruption was devastating, with millions at risk of falling into extreme poverty. We also saw significant impacts on mental health and delayed medical treatments. The cost-benefit analysis must include these factors. Dr. Fauci defended every single federal COVID-19 response. He supported business closures, school closures, and stay-at-home orders. Yet he admitted there was no scientific study behind the 6-foot rule. This suggests an overreach, where the cure might have been worse than the disease for many. The severe impact of COVID-19 lockdowns on society demands a deeper look at the decisions made.
Ada, I do acknowledge the challenges and hardships people faced during lockdowns. There were certainly negative impacts, like learning disruptions and mental health strains. However, these were often unavoidable consequences of a global pandemic. The alternative, allowing the virus to spread unchecked, would have led to far greater loss of life and an even more catastrophic collapse of our healthcare system. We were in an unprecedented situation. Dr. Fauci and other public health officials were making decisions to save lives based on the best information they had. Studies show that lockdowns can substantially reduce infections. These measures bought time for vaccine development and for hospitals to prepare. It's easy to criticize in hindsight, but in the moment, the priority was to reduce deaths and severe illness. The long-term effects, while real, must be weighed against the immediate threat the virus posed.
This stress test reveals the core tension of this debate. How do we balance immediate public health crises with the broader long-term societal and economic well-being? Both sides present valid concerns about the trade-offs involved in pandemic response. It's clear there are no easy answers when navigating such complex challenges. This brings us to our closing arguments.
The lasting legacy of Dr. Fauci's influence and public statements on COVID-19 lockdowns is one of overreach and a disregard for individual liberty and economic stability. We now know that many of the policies he championed, like the 6-foot rule, lacked solid scientific backing. His own diaries show a disconnect between his private thoughts and public pronouncements. This created a crisis of trust that still affects our institutions. The massive economic damage, the learning loss, and the mental health crisis among young people are undeniable consequences. We must learn from these mistakes. Future pandemic responses must be more balanced, transparent, and respectful of the full spectrum of human well-being, not just one narrow view of public health. We need to empower individuals, not just top-down mandates.
Nico, the narrative that Dr. Fauci acted without scientific basis or caused undue harm ignores the reality of a rapidly unfolding crisis. His public statements on COVID-19 lockdowns were rooted in decades of experience with infectious diseases. His advice was consistent with global public health efforts to contain a deadly virus. While some measures had unintended consequences, the primary goal was to prevent millions more deaths. The evolving science meant that guidance had to change, and Dr. Fauci was transparent about that process. To portray him as a villain is to misunderstand the immense pressure and uncertainty of the time. We needed strong leadership and clear guidance to navigate the unknown, and that's what Dr. Fauci provided, saving countless lives in the process. We must support our public health experts.
Jordan, while you emphasize the immediate crisis, we also need to consider the comparative effectiveness of these lockdowns, especially when looking at international data. Countries like Sweden, for example, adopted a much less restrictive approach, relying more on voluntary measures and individual responsibility. Yet their overall excess mortality rates were comparable to, or in some cases, even lower than, countries that implemented severe, prolonged lockdowns. This suggests that the draconian measures advocated by Dr. Fauci and others might not have been as uniquely effective as claimed, and perhaps the immense societal cost was disproportionate. Furthermore, the long-term impact on educational attainment, particularly for disadvantaged children, is now becoming starkly clear. Studies from organizations like the National Bureau of Economic Research indicate significant learning loss, which will have cascading effects on future earnings and social mobility for an entire generation. This isn't just about unavoidable consequences. It's about questioning the efficacy and necessity of such extreme interventions when less disruptive alternatives yielded similar public health outcomes.
Nico, comparing Sweden to other nations often overlooks crucial differences in demographics, population density, and healthcare systems. Sweden's population is significantly less dense than many other European countries or the United States, and they have a culture of high trust in government recommendations, which played a role in their voluntary compliance. Many analyses, including those from the World Health Organization, have highlighted that while Sweden avoided a full lockdown, their death toll per capita was still higher than many of their Nordic neighbors who did implement stricter measures. Moreover, the argument about long-term educational impacts, while valid, needs to be contextualized. The alternative of an unchecked pandemic would have led to even greater societal disruption, including higher rates of parental illness and death, which would undoubtedly have had a far more devastating and permanent impact on children's education and well-being. Dr. Fauci's recommendations were aimed at preventing a collapse that would have dwarfed even the significant challenges we now face. The focus was on mitigating the worst-case scenario, which thankfully we largely avoided.
And that brings us to the end of another insightful discussion on the political bridge. Today, Nico and Jordan have offered compelling arguments regarding Dr. Anthony Fauci's influence and public statements on COVID-19 lockdowns. It's clear this remains a deeply complex issue with significant impacts on public health, the economy, and individual freedoms. We appreciate both of your perspectives on this challenging topic. Thank you to our listeners for tuning in. You can find more information and resources at tpbridgepod.com. Join us next time for another engaging discussion. Until then, stay informed, stay engaged, and keep bridging those political divides.